Okay. Hello everyone. Now, the 11th question. A patient came with the complaints of inability to move his fourth and fifth digit and cannot hold pen. He was not able to hold paper in between the fingers. Which of the following site given below is probable cause of injury to the nerve? First of all, we have to find out which nerve got injured. Then, second is where is the most probable, like common site for injury of that nerve. So, can you think the fourth and fifth digit are mainly injured when you can you tell me? Fourth and fifth digit are mainly supplied by ulnar nerve. So this is the medial side, this is the lateral side, thumb will be the lateral side. So all this 3.5 finger is supplied by median nerve. Now they are telling that he can't hold a paper in between the fingers. So if you tell the patient to hold a paper in between the finger, he can't hold. That means he can't do the adduction of fingers. So adduction of finger is by which muscle? That is palmar interosseous. It is a pad muscle, palmar interosseous for adduction. So this is palmar interosseous muscle is supplied by ulnar nerve. So we got to know that here the nerve injured is ulnar nerve, but they're asking the common site, which site may be injured. So they have given a bone picture here. D is the neck of the humerus bone. Here A is the radial groove, and B is the medial epicondyle. How to know medial? So neck side will be the medial side, and C is the lateral side. So when there is injury to the neck, there will be injury to the axillary nerve. A, there will be injury to the radial nerve, and B is mainly for the ulnar nerve. If there is fracture of the lateral epicondyle, then there will be a stretching of the medial side of the ulnar nerve. So there will be ulnar nerve palsy. So here we got to know that option B is the answer. Next, coming to the which is the structure that passes through the central tendon of the diaphragm. We draw the diaphragm. The first, second, third opening, three openings are there. First opening is in the central tendon only, that is for inferior vena cava. Next, with along with inferior vena cava, which structure will pass? It is right phrenic nerve. There is a see. This is the central. This white part is the central tendon. Here, inferior vena cava opening is there. Inferior vena cava. This is at the level of T8. Okay. Along with the inferior vena cava, there is a right phrenic nerve also passes. Next, in the second opening is for esophagus. Here with the esophagus, there is two nerves will pass. That is, which nerve? Two nerves will be there. That is the vagus nerve, phrenic nerve over vagus nerve. This is at the esophagus is at the T10 level. Next, T12 is aorta. Aorta will be there. Here along with aorta you can see thoracic duct, azygous vein, hemiazygous vein. Almost all veins will be there. Hemiazygous, azygous, and aorta is a artery. Along with the thoracic duct will be there. Okay. Now coming to 13th question. I have put only ABC option here because the D option pictures I did not find. Okay. Which of the following represents hollow crane gland? Hollow means what? The whole of the cell will get pinched off and the site will be left behind. So, which might be in this holocrine gland. Example for holocrine gland is sebaceous gland. So, can you find out which is the sebaceous gland in this? That is C. C is the sebaceous gland. All other glands let us discuss. First one is a merocrine gland. Here the only the secretions will come out, not the gland or apex. But the example is actually sweat glands also, and here submandibular gland is also a example for merocrine gland, salivary gland. Next, apocrine gland, the apex is pinched off. Here the example is mammillary gland. Apo for apex is pinched off. Whereas holocrine gland, whole gland gets dislodged. Whole gland will come out. That is sebaceous gland. Okay. 13th one over. This is 13th one. Okay. 13th one. Next, coming to the 14th one, which of the following is connected to the structure marked A? Here the A is here we have discussed in the previous section that what is A? A is nothing but the splenium of the corpus callosum. This is the genu, this is the body of corpus callosum, and last one is splenium. Now they have not asked us the straight question that the uh, which of the following is connected to the structure marked A. So they are asking this is splenium, okay, but what structure is connected to that? Actually, the splenium connects to the occipital lobe, okay, through which that is called as striate cortex. Here you have to know the name of striate cortex. That is the only thing you have to know here. That name you have to know. See, the corpus callosum arches posteriorly like this, and ends as a thickened posterior portion. This is called as splenium. The fibers of the splenium forms a forceps. Okay, that is the major forceps. That is called as major forceps. That will arch backward into the occipital lobe. That is nothing but striate cortex. The hippocampus is not connected directly to the splenium, but it is situated inferior to the splenium. This one thing you have to remember. Next, coming to the 15th question, identify the pelvic diaphragm in the given picture. You know there is a urogenital diaphragm and pelvic diaphragm. Two diaphragms are there. After perineum, this diaphragm will come. So this is the actually deep structure. The pelvic diaphragm is the deep structure. Which is the pelvic diaphragm? Here D is nothing but urogenital diaphragm, whereas B is the pelvic diaphragm. So B is the answer for this. This is 14th question. This is 15th question. See, this is the urogenital diaphragm. They have asked about pelvic diaphragm. This is the obturator internus muscle, and these are the three muscles surrounding this. So you can see in the urogenital diaphragm, you can see there is deep space and superficial space also. Next, coming to the 16th question, they have asked which of the following structure of the scapula is palpable in the inferior clavicular fossa. So when you press in the inferior clavicular fossa, you can palpate something. Which part of the scapula they are asking? So here actually the B, the marked B is the coronoid process. This you can palpate when you press in the infraclavicular fossa. What is A? A is the acromion process. Here you can see. This is the scapular notch, this one, and superior angle middle border. This is the subcapsular fossa and inferior angle. Next, neck of the scapula, you can see glenoid fossa, coronoid process. This is the answer for this question. So B is the answer. What represents the marked area in the given histology? They have marked one place and they are asking what is that. This is the mantle zone. This is the mantle zone. This is covering the germinal uh, center. This is the paracortical zone, and this is the capsule. And below the capsule there is subcapsule, and in the below the subcapsular there is a marginal zone, but it is always mixed, so we can't see the marginal zone. It will be in the see, it is in the peripheral lymph node. The marginal zones are inapparent because they get mixed with the mantle zone cells. They will mix here the mantle zone cells. Yes. Next, coming to the, so this answer is, they have marked is the mantle zone. Okay, marginal zone will get mixed, you can't see that. Okay. 18th one, young patient presents with hypoparathyroidism. Hypoparathyroidism, absent thymus, and tetany. Which of the following marked area in the feature is defective? So, oh, you had to know that. Thymus and parathyroid both are absent, they are telling. So, here upper one is the parathyroid. So it is the inferior parathyroid, whereas down pink color is the thymus. If this third pouch is missing, then it will be the hypoparathyroid will be present and the absent thymus will be there. This is mainly in the D George syndrome. Next, coming to the 19th one, 58-year-old woman was undergoing cholecystectomy. During the procedure, the resident accidentally advanced the seizure along the superior border of the epiploic foramen, causing the injury. Now they are telling following structures likely to be injured. So when the epiploic foramen gets injured, the main structure of the liver that gets injured is the caudate lobe, because it forms the superior border of the epiploic foramen. You can see the picture here. The superior border is formed by the caudate lobe, and anterior boundary is by the portal vein, hepatic artery, and these are the actually the content, and inferiorly by the duodenum. Next question, 20th one, which of the following structure marked below gives rise to the heart of an adult? This red marked structure forms the heart. In the any picture, if something is red and they are asking about heart, that is the answer. So, and A. I'll show you the picture. This cranial end forms brain, caudal end there marking a spinal cord. This is the yolk sac, and this red thing is the heart. All of the following are true about Grey Rami communicates, except they have asked. This thing I am not going to explain in detail, but there is two Rami, Great Rami and White Rami. This Grey Rami is unmyelinated, correct. Connects to spinal cord, yes, correct. Present medial to the white rami communicates is also correct answer, but it's not preganglionic. It is has only postganglionic. See, this is the gray A rami, whereas this one is the red thing is there, no? That is white rami. That is actually it has a preganglionic fiber, but the gray rami don't have a preganglionic fiber. Okay, next coming to the 22nd question, which of the following structure uh, does the cell pointed in the arrow inhibit? Actually they're asking this cell is inhibiting something. What is it inhibiting to? So first we have to identify this thing. This is the Purkinje fibers. Purkinje fibers has a very long nerve fibers. This has a inhibitory fibers to the deep nuclei of the cerebellum. Okay, this is also their favorite question only. Next, the image below shows the insertion of transverse abdominis muscle. Identify the conjoint tendon. Which one is the conjoint tendon in this picture? Can you know? Can you tell me? Actually, all the fibers that should come and meet at the some point. That is C option. So C is the conjoint tendon. This conjoint tendon is formed by the lower fibers of the internal oblique and the lower part of the transverse abdominis muscle. These two together forms a conjoint tendon. Okay, thank you.